Good morning, ladies and gentlemen. I'm Sylvain Giraud. I'm the head of Unit Health Systems in DG Health and Food Safety in the European Commission in Brussels. And it's my pleasure to join you this morning via this video message to share with you some views which hopefully will contribute to the reflection you are having during these 2 days in Naples. I'm also happy to join this event by video, as it gathers several key players from the European Partnership on Active and Healthy Aging, and I'm aware how successful the partnership has been in generating mutual learning and cooperation between various stakeholders and primarily local and regional health authorities. Ladies and gentlemen, we all know the challenges our health systems are confronted to, and we know that these challenges now ask for changes in the way healthcare is delivered, organized and financed across Europe. Health authorities these days are looking for ways to put more emphasis on prevention, to shift activity from hospitals to primary and community care, to integrate care across the levels of care and between social and health care, by focusing on people's needs, taking, of course, advantage of the potential of digital technologies to achieve this. How do we go about this? The national authorities, the regional authorities have already starting to transform their health systems. But for such transformation to scale up and to succeed ultimately, to deliver the expected benefits, we see two very important preconditions. The first one is, of course, quite logically, the need for sufficient mobilization of investment. The second one, which too often is forgotten, is the need to have the necessary know-how and capacity to design and implement the new care models we're looking for. Let me focus first on the first precondition, on the investment. If we want to move away from the traditional hospital-centered model to more person-centered approaches, this definitely requires investments in new types of physical infrastructure, but also softer investment in less tangible elements, such as, for example, prevention program, health promotion programs, patient employment programs, integrated care services, training of workforce, patient pathway, digital tools to measure, to share data, to monitor results, to assess the performance. So a broad variety of investment needs. If we look at if we try to assess what would be the elements, the fundamental elements to engage in such investment mobilization, one could maybe make the following 4 or 5 suggestions around the 4 keywords: long-term, blending, partnership, and contracting. Long-term, health authorities would certainly need to develop a long-term investment strategy which takes an integrated approach and that considers together the investment needs for infrastructure, for innovative technologies, but also for new care models. The second idea is that no single financing instrument covers alone all what's needed, and that an integrated investment strategy would require to blend financing from different sources. The third idea is that health authorities need to look beyond the usual funding sources, national budget, EU grants. They need to go beyond that, and they need to develop partnerships with new stakeholders and new investors and learn how to manage new financing instruments. And the fourth idea is that contracting and payment models need to be considered in conjunction with the planned investment, as they determine whether the investment will turn into successful delivery of services or not. Coming back to where I speak from, the EU level, what can the EU then offer to support investment? Well, the EU first obviously offers the support to national and regional authorities via the structural funds. And in DG Health, DG Santé, we have recently conducted a project that is called European Structural Funds for Health, which has mapped all the structural funds actions that have been supporting health in the current programming period. So we have produced this inventory of action, and that shows the diversity and the creativity of the projects that are there, and it's also a very important source of inspiration for those that are looking for such projects or to use structural funds for their projects. So what the EU can offer? First, the structural funds. Second, of course, we are now at a moment where the EU is looking at its next programming period at what we call the next multi-annual financial framework, MFF. And in the next period that will start after 21, the structural funds will continue very strongly to be an opportunity for those that want to invest in health. And it is important for health authorities to seize these opportunities and to get ready to engage in the process of programming as early as now. In addition to the structural funds, the EU also proposes a certain number of support instruments in the form of loans or other financing instruments for investors. The example of that was the investment plan for Europe and the financing instruments that accompanied it. That's called European Fund for Strategic Investment, FC. This is going to continue being an opportunity in the next multi-annual financial framework through what will now be called the Invest EU Fund. Let me now turn to the second precondition that I mentioned earlier. This is the need to have in place the right knowledge on how to implement new models of care. Because accumulating the required fund and making investment is not enough. We need to make sure that the implementation can be successful through the reform process. And many health authorities feel they don't yet possess that sufficient know-how and the capacity to do that. So there can be ways to develop technical support and capacity building in these authorities, and the EU, there again, will continue to support this. First, by networking, by supporting networking between authorities and local authorities in particular, and the example of the Active and Healthy Aging Partnership is certainly an example that we should look at how to prolong and continue for the future. We also recently made available an online resource center for integrated care on the EU health policy platform on the DG Santé's website. This is gathering knowledge resources in one place with good practices, case studies, tools and guidance material, and it offers a single reference area where stakeholders can find a variety of knowledge and tools to help them prepare better for the transition to integrated care. Through the health program, the EU health program, which will also continue to be useful in the next multi-annual financial framework, through this health program we are financing and will continue to finance projects to identify the transfer and replication of best practices to new locations, and in particular those addressing chronic disease, their management and their prevention. Finally, we need to develop a strategic approach to make the best use of the digital transformation of health and care. And we all know that the digital solutions offer important opportunities. In a recent policy paper the Commission issued in April this year, April 2018, we have put together a certain number of actions from EU level, but also from stakeholders and also from national level to facilitate the wider use of digital tools for citizen empowerment and patient-centered care. Ladies and gentlemen, I hope I have given you a flavor of some important consideration and an idea of the actions that are being developed at EU level regarding support to investment in health systems. We can draw a lot of hope and guidance from early achievements, but we certainly need all collectively to ensure that the stakeholders come together and plan and collaborate to invest in public health and health care across the EU for the future. I wish you a very successful event. Thank you very much.